Hi, this is Dr. Nemechek, and welcome to the Nemechek Navigator. This little series, this little video is going to be on how can you tell the difference between an awakening that may have some of the negative like agitation or hyperactivity and inulin intolerance. Okay, let me describe what I mean by awakening. So as we talked in another video, if you balance the bacteria successfully and that bacteria is producing a psychogenic compound, say like propionic acid, that's suppressing your child's kind of cognition, the child will kind of come out of it, almost like they're sobering up or something. They're more aware, they're more alert, and so forth. But sometimes you can have some increased hyperactivity or maybe a little aggression or some insomnia, all right? Now, inulin intolerance. This means inulin does, in and of itself, seems to cause some negative side effects. And what has been surprising to me, that it's quite clear in my use of inulin over the last decade, is in kids, in some kids, not all kids, and I can't tell you what relative proportion it is, but it's more than just a few. If you give them too much inulin, they behave as if the inulin is somehow having an effect with either the bacteria, the nervous system via the bacteria, or the nervous system via some other mechanism we don't understand yet, because the inulin doesn't get in the bloodstream. So there's some other middle step here is causing the nervous system, the regulation of blood pressure in the head, in their brain, to decrease. This causes anxiety, hyperactivity, increased hunger, increased thirst. Now, sometimes that can kind of look like the awakening. And parents are like, well, how in the heck do we know which is which? Well, one, don't go beyond the doses I recommend of inulin in the book, okay? And you can see the doses in the Nemechek Navigator dosing guide, all right? So don't go above those doses. That's one way to prevent this from happening. But it's happened. We've had inulin intolerance at even the doses I recommend. And it does not, inulin intolerance, the child won't get over it. I've never seen it like just go away. And so whereas the awakening after, and this is really the way you have to sort this out. Say you're using the appropriate doses, you get some agitation, a little hyperactivity, and you may even have some better eye contact and things like that. How do I tell the difference between awakening and inulin intolerance? Well, if it's the awakening, what I'll see in my patients is the child starts improving. In 1 to 2 months, there are clear signs of improvement, okay? And in inulin intolerance, just doesn't seem to get better. That kind of agitation, the hyperactivity, anxiety stuff just does not, 2, 3, you might even be 4 months out, that is just not improving. Even though you might have other gains, that's inulin intolerance to me, or at least that's how I interpret it. And then at that point, I would stop the inulin, and then I move on to monthly rifaximin, which you can watch one of the other videos, and there's a variety of questions we have on that in the database. So I hope you find that helpful. Again, this is Dr. Nemechek of Nemechek Navigator. We've designed this platform to try to help you answer all your questions, help give you confidence in what you're doing so you can help manage your child's recovery. All right. Take care. Thank you.